Hello, everyone. Good afternoon on this final Friday of October 2023 and the wrap up of Sudden Cardiac Arrest Awareness Month. You're at SADS Live number 128. If you don't know, you should. We are the Sudden Arrhythmia Death Syndrome Foundation, arguably the largest and perhaps only nonprofit organization completely dedicated to families at risk of sudden cardiac arrest or potentially tragically sudden cardiac death from genetic heart rhythm conditions. And you know the names. They include diseases like long QT syndrome or catecholaminergic polymorphic ventricular tachycardia, CPVT, Brugada syndrome, arrhythmogenic cardiomyopathy, ARVC. We have a lot of the letters of the alphabet covered. And we hope this is your home, and I hope you find confidence and answers to your questions. We love having you part of the SADS family. Obviously, we wish you didn't have to be a member of the SADS family because then you won't have one of these conditions. Well, I'm Mike Ackerman, a genetic cardiologist at the Mayo Clinic and director of Mayo Clinic's Winland Smith Rice Genetic Heart Rhythm Clinic and director of our Winland Smith Rice Sudden Death Genomics Laboratory. And I come to you as president of the board of SADS Foundation for many years now, partnering with our CEO, Alice Laura. And Alice gives you greetings. The team at the SADS Foundation, Aaron, Marcia, Jan, and company, Anna, are all have spoken with you or look forward to meeting you and getting to know you. So feel free to get to know us. Check us out at www.sads.org, or if you like, because this is how we like to think of it, www.stopsads.org, and you'll find incredibly helpful information. Well, this is, as I said, the 128th episode, and this one I'm really looking forward to a conversation I have with just a wonderful mother and daughter. I've had the privilege of caring for them and knowing of their story directly. And I take a moment to just express gratitude for all of the patients and families that I get to consider part of my family and one of my patients. And in fact, this week, we at Mayo Clinic celebrated seeing the 5,000th patient evaluated in our genetic heart rhythm clinic. So we just crossed number 5,000, and each and every one of you are special. I appreciate you, grateful for each and every one of you. For those of you who I'm an indirect part of your care, but not considered your physician, delighted to partner with you and provide information for you to where you feel like you're a part of the SADS family. We are wrapping up. The month of October is Sudden Cardiac Arrest Awareness Month, SCA. And as you know, 2 weeks ago, we talked about with LifeSure and having the automatic external defibrillator as part of family safety gear for those where it makes sense and it could bring value, and how LifeSure does an amazing job, pit bulls in their tenacity to do interference with your insurance company to compel them that, yes, the right answer is provide coverage for that automatic external defibrillator, even though the likelihood of a patient who has been diagnosed and treated with their SADS condition needing that AED is very, very low. To date, as we think of sudden cardiac arrest, among my patients, we have only had 4 AED rescue shocks in only 4 of over 800 long QT children, and so far none of my CPVT patients in these last 23 years. Well, as we wrap up SCA Awareness Month, I'm joined and will be joined soon by Carly and her mom to hear their story. They've taken time out. Carly's a senior and she's doing college tour day or university tour day at UC San Diego, but they're breaking out of the tour to join us and reflect on their journey so far and how their genetic heart rhythm condition came to discovery, how it was a very close call to becoming a sudden cardiac arrest. And we're going to learn about her story. So Erin is going to bring on one or both of them. We'll see what Erin does. Carly, and her mother, Allison. And so there they are. We have Carly down at the bottom, Allison to screen right or screen right, whichever direction. So thanks for joining us. Thanks for taking time out of your college visit, Carly. Great to have you at SADS Live.
Thank you for having us.
Now, as we learn your story, remind me, Allison, that there's no story in the family until Carly does her thing. Is that right?
That's correct.
And what was, if you remember it, Carly, you can share it. When and what was your first thingy where you revealed possibly that things were not right with your heart?
The first time was when I was 10. We were in Tahoe for a soccer tournament, and I was on a bungee jump cord thing that they have in many malls, and I went into sudden cardiac arrest while on it. And then after that, a bunch of tests, but no diagnosis for almost 3 years.
So think about that day, Mom. Age 10, she does something bungee cord. Is that right?
Yeah.
She collapses suddenly, and you had to do something special to revive her, or somebody did?
Yeah, so she was she had a couple soccer games in the morning. We went up, which is now it's called Palisades at Tahoe. At the top they have a roller rink, so they went roller skating, and then we came back down and they have these bungee cord suspension trampoline apparatuses that the kids can play on. And actually all three of my kids were each on one, and I was kind of going around taking pictures. And when I got to Carly, she went limp. And at first I thought she was playing and like pretending like she didn't want me to take her picture. And then she didn't respond. And then her body kind of jerked a little bit, and I realized something was wrong. So we kind of jumped the barriers into this little trampoline area, and had the people who were running it lower her down. When they got her out of the harness, she had lost urinary continence. She was non-responsive. She was really just kind of doing what we call agonal breathing, so just kind of gasping sporadically. And we couldn't really feel any kind of a pulse, but we were all, super nervous and panicked at the time. So we realized we were probably going to need to do CPR, but she was laying on a trampoline. So we had to pick her up and carry her off over to an area that was a harder surface. And she, at that point, still was not breathing and was not, not conscious, not aware. And so I started chest compressions on her. And after, a few, I don't know how many rounds of compressions I did. Fortunately, a physician was walking by and he was like, "You're not doing chest compressions, are you?" And I was like, "Yeah, she's not breathing." So he knelt down and, grabbed her wrist to see if he could feel her pulse, because he wasn't, didn't have the adrenaline going. And at that time, she kind of started to open her eyes and move a little bit, but she was blue. And so he was, we kind of watched for a minute and then did a few more compressions, and then she kind of aroused but was completely kind of like out of it. So she couldn't see for probably almost, 12 hours. Like everything was fuzzy and blurry to her. So paramedics came and they did an EKG, and of course it was completely normal. They did blood sugar check on her. That was also normal. And so they chalked it up to altitude sickness. And so we were like, wow, I don't know about that. So when we were up there, in the area, there's only tiny little critical access hospitals, not much services to be offered. And so, they said she seems stable. You can send her to the hospital. They'll have to transfer her probably to where we live. or you could just watch her and bring her in if something happened. So we just took her to the house where we were staying, watched her overnight. She was just kind of out of it all night, but then seemed to be better the next day.
Wow.
And we took her for follow-up testing. Once we got back home, they did a repeat EKG, which showed really, really very mild, like prolonged QT, but nothing that would concern anybody. That they were saying it was just sort of a normal abnormal. And echo was normal.
And that evaluation, if I could interrupt,
Mhm.
Allison, so it's pretty amazing to hear you tell this story, that what you're doing to your 10-year-old who faints suddenly when they're playing, you and another passerby are needing to do chest compressions to revive her, and then they just say, go ahead and take her home. That had to
Yeah.
be rather unsettling for you to say, oh my goodness, what's going on here? And so then you see the cardiologists when you get back home, and we go from altitude sickness to what's their conclusion after they heard your story and did another round of testing?
They said it was a vasovagal event. And I said, she was out for probably 5 minutes and she lost continence. And they said, yeah, it's unusual, but everything's fine.
Okay. And again, at that time, no, they did echo, they did the ECG, but yet again, as the story will unfold, they did not put your daughter on a bicycle or a stress test or a treadmill to do sort of any stress testing.
Correct.
So she goes on her way. We now finished year 10. 10 was a pretty dramatic year, Carly. And then does it rear its head again, or was it just a one and done?
It was one and done for that year. And then it came back at 13 was her second event.
Okay, and Carly, what was that one? So now you're a teenager. And what did you do as a teenager?
I was swimming in my pool and playing Marco Polo with my brothers and my neighbors, and started to feel like lightheaded and tried to push myself up onto the side of the pool deck. And then I don't remember what happened after that, but came to on my own. So we're still not sure if that was actually a sudden cardiac arrest event or not. But it seemed similar to the one that I had in Tahoe. But again, nothing after that.
And so now she does a water thing. And for those of you who've joined us throughout the world, if you have some ideas of what Carly's diagnosis is, go ahead and type them in the chat line. I'll be curious what you're thinking is going on at this time in Carly's mystery. Starts with the trampoline bungee thing. Now she's a teenager and she does something in the pool. And after the pool thing, do you guys go back to doctors?
No. It was maybe 20 days later that I ended up having another event while I was dancing on stage for a dress rehearsal. The second the music starts, I turned around and don't know what happened after that.
Okay. And so just out of curiosity, looking back, Mom, the water thing, we didn't act on that. And do you think that was in part because the healthcare team lulled you all in a sense of false security that, oh, this is just some vasovagal stuff?
Yeah, absolutely. And even after, we were in Tahoe and I'm doing CPR on her and having this, other healthcare professional there, kind of dismissing me like, why are you doing CPR on her? Let me check it out. And so it really made me think, God, did I panic and overreact? And maybe it wasn't as big of a deal as I thought. And maybe it wasn't maybe I didn't need to do CPR. And I felt, oh my gosh, I could have cracked her ribs. And I'm lucky I didn't. And so I was doubting myself the whole time. So then, when it was vasovagal, I thought, oh my gosh. So when she had her event in the pool, it was like 3 o'clock in the afternoon. They'd been playing hard all day, swimming all day, and she had not eaten. And so I was like, hey, you're susceptible. You need to be careful. We got to make sure you get lots of fluids and that you're, have nutrition in you. And so we kind of thought that maybe that was what that event was.
And so now we're doing a dance recital thingy. And do you remember what song, Carly, you were dancing to?
Yes, it was Smooth Criminal by Michael Jackson.
Well, and so during Smooth Criminal by Michael Jackson, did you just bam collapse without much warning? Were you dizzy? Or you just collapse?
It was like I turned around and it all kind of felt like my vision just was closing in and not sure what happened. It just fell face forward.
Yeah, and between your first awareness that something wasn't quite right to falling face forward, was that like 3 minutes of forewarning, or was that 1001, 1002 down?
Like seconds.
Yeah.
Yeah.
And with that one, do you come back on your own, or do people need to be heroic to revive you from that one?
No,
Yeah.
I had help revive me.
And revive you with electricity, or revive you again with chest compressions?
No, it was just chest compressions again.
Okay.
So that one, she was on stage, and at first it looked like she slipped and fell, and because they were doing a tap routine, so she was in tap shoes and they did the spin around. So I thought she just slipped, but then she didn't move. And when she went down, there was no attempt to even break her own fall. She just fell flat on her face. She had cut her lip and was all swollen. And so that time, by the time I got to her, I had to run down the theater and up onto the stage. And, I rolled her over, and she again was, blue and not breathing. And I was checking her again, and I could feel a very thready pulse. So I, in my head at the time, was thinking, oh, well, she still has a pulse, so I don't need to do anything just yet, And so I was kind of doing sternal rubs on her, trying to get her to kind of breathe on her own. And then she again was turning blue. So we started the chest compressions, and someone was running to get the AED. And then she started to come around by the time the person got back. So we were in like a high school theater, and the AED was across campus in the nurse's office. And so they had to go run and unlock the room and get it and bring it back. So there was a significant delay. But fortunately, she came back without needing to be shocked.
So now so don't give the answer yet, because I see some answers from Jessica. Hi, Jessica, and Julie and Valencia. They're all voting for type 1 long QT syndrome. And I'll just tell you that unfortunately, the three of you, and you three are wonderful people, but you are wonderfully wrong. And why are we wrong? You remember they gave us a clue. She's done 3 dramatic spells, but they're telling her ECG is normal. Now, one possibility is they don't know how to measure the QT interval, and it's actually wrong. But if they measured it right, you never ever do LQT1 triggered spells with a normal QT interval. The only way you do LQT1 triggered spells almost always is because you have a whopper of a QT interval. You have a long QT interval that you can see on the ECG. So those guesses, good ones, but they're wrong. And another guess is Brugada syndrome, and we need to bring Brugada syndrome up, but wrong. And why wrong on Brugada? Well, Brugada syndrome almost never does spells during exertion, during activity. And so for Carly, we have 3 of them. Strike 1, trampoline, age 10. Strike 2, swimming pool, age 13. Strike 3, 3 weeks later, Michael Jackson faint. And so now after this one, do you say, Mom, strike 1, strike 2, strike 3, our daughter's out, we've got to figure this out, and go back to doctors? And do they solve it then yet, or still not yet?
Eventually, yes. So I had them. So I'm also a nurse and I work at a local hospital. So I had them take her to my hospital, even though I knew we didn't have advanced pediatric services, because I knew I could get the ear of healthcare providers that could help me. And so I had to navigate from the inside to get what we needed. So they couldn't find anything again. So EKG, where the QT was just a little bit off. She did keep having some kind of strange ectopy, but not long enough that they could see anything that was abnormal, except they were calling, well, she's having ectopy. But she was she was out of it, almost like she had had a seizure. So in that, she's just very groggy. Again, had trouble with her vision for several hours, and maybe almost a 24 hours. You can correct me if I'm wrong on that. And so, I had explained and pleaded, and so they admitted us this time to the children's specialty area. And so they went down the neuro route. And so they did a 24-hour the is it ECG?
The brain one.
And yeah, EEG. There we go. And I get all my letters wrong. And so they did a video EEG on her for 24 hours, and they tried to induce a seizure with medication and stimulation, and none of that worked. And she had no abnormalities whatsoever. So neuro signed off, and cardiology signed off without coming to see her. But fortunately, our pediatric cardiologist is an amazing human and gives us his cell phone number. So we call him and he returns our call on vacation. And he said, she needs to see an electrophysiologist. And so, fortunately, his guidance got us in, but they discharged us from the hospital without a diagnosis, even though I was trying to handcuff her to the bed. Like, no, you can't let us leave here without a diagnosis. So we went in to see the electrophysiologist, and he repeated the studies, but he did not do the treadmill test initially. And so then I'm feeling very uneasy and nervous about this. And I went back to work and talked to one of my adult electrophysiologists. And I told him the story. And his response to me was, well, did they send her home with a life vest? And that just gave me chills all over my body. So the life vest is an external defibrillator. And
That you
and
wear,
so, yeah.
that you wear. So yeah, I mean, I can imagine. I mean, I guess, part of me, in hearing your story again, and as I know, Carly, in your story, it just makes me so mad. I find it just, it'd be one thing if I was hearing this story circa 1993, 1983, 2003, maybe I would spot that. But we're talking the new millennia, and for whatever reason, we are failing in acting on a warning symptom with a stress test. And the delay in ultimately the correct diagnosis that we're going to come to pretty quick, drum roll, is just completely unacceptable. And we at SADS, we need to do better. We thought we were getting the warning signs out to respect adrenaline triggered spells, activity related spells, but it takes an adult heart rhythm doctor to say life vest. But then does he or she order the stress test finally, or how far away from the Michael Jackson faint does it take before we even get on the stress test?
I think it was about a week.
Okay.
It wasn't horrible, but it gave me, so he did not prescribe the life vest, but it gave me the courage to call the pediatric electrophysiologist back. And then I'm feeling like a bad nurse patient. and overstepping. And I don't want to ever make someone feel that I'm questioning judgment. But I told him, I had this conversation, and then he goes, you know what, you're right. And don't feel bad. I should have done this when you were in the office. You need to come back for a treadmill test. And then she was on the treadmill for, I don't know, it seemed like 45 seconds. And he shut it down and was like, okay. And I immediately was like furious because I thought, what could you possibly have seen in 45 seconds to help us? And he's like, Carly, get dressed, mom, come with me. And so he had alluded and told me, I think she could possibly have this. We could work this up. And then he just held up her EKG strip and showed it to me. And it was just so spastic that I knew exactly what it was. He didn't even have to tell me.
So any more guesses on the sidebar before we reveal the story? Somebody says WPW. Nope, WPW doesn't do that. But the thing that does this, and there are many of you with it as part of the SADS family, is, let's see, does anybody want to say? Ferris Bueller Day Off? Yes, Julie, winner, chicken dinner for Miss Julie. CPVT, so easy to diagnose if we do the right test. Catecholaminergic, polymorphic ventricular tachycardia. And I gotta wonder, Allison, after you get this stress test and they basically figure it out within 45 seconds of the stress test, I'm guessing chills ran through your body thinking the first spell was 3 years ago. And have we just, and the diagnosis was so easy that quickly that we almost had strike 3 and we're out. Did you go through the gamut of mom and patient, I don't know, fear, trembling, anger, all of the above?
Yeah, I was, I feel like I still have a little PTSD every time you allow yourself to think of like what could have happened if, we went so many years without a diagnosis, and we are so lucky that nothing, permanent happened. And, we're fortunate to have found the right diagnosis and then received the right intervention. But yeah, I was definitely furious that I'm on the inside. I'm very well connected with, chief medical executives or who got me to where I needed to be. And it still took 3 years for us to navigate the system and get the right guidance and the right information. And just what really struck me was just the lack of awareness of what potential, what should be on that differential diagnosis, what should be ruled out. And, to settle with a vasovagal, which is so benign, to have the complete opposite be the reality and not have any, consideration in between really strikes me.
Yeah. And I'm so impressed. Your story, Allison, is like so many of my mother's, where if it weren't for the mom's gut instinct and tenacity, there's just that drive, isn't there, to get things solved when it doesn't make sense, and to pursue it on behalf of your daughter. And Carly, I'm wondering, as you think back and you hear your mom reflect on those 3 pretty dramatic years or 3 dramatic spells, what would you like to be seeing happening so that another preteen or teen and their family doesn't have to go through what you experienced? What needs to happen from your standpoint?
Oh gosh, I don't even know how to answer that. I feel like just more like advocating, even self-advocating for like your own personal symptoms, but also like what my mom did. I think I'm very thankful for what position she is in and that I got a diagnosis in 3 years. Who knows, it could have been longer. I think also in schools, having more testing or awareness, like with the AEDs, even with just having an episode at a high school and having to go find the AED and it not being close by. I'm lucky that my school has like a plan, which makes us feel more secure, like for me going to school. Not sure what else though.
Yeah. How about you, Mom? I mean, one of the things I've advocated for, and obviously not successfully enough, but when I met you all, you sort of helped me light the fire again, is that I think every child, every teenager, everyone who faints suddenly during activity, during exertion, must be put on a treadmill, period. And I don't know what it's going to take to make that, a reflex that's mandated or becomes the norm. I mean, had we put your daughter on the treadmill when she came down from the mountain, we would have known the diagnosis. Had they put her on the treadmill when she got out of the swimming pool, we would have known the diagnosis, and not have had to have uh, too many close calls, right? I mean,
Right.
Carly, you should have had one spell in your life, the first one. We shouldn't have spells 2 and 3, because we would have done the right test, the stress test, made the right diagnosis, in your case CPVT, and put you on the right therapy, which you are on. And impressively and somewhat surprisingly, you escaped all of this without an internal defibrillator being thrown in. And you got treated well with 2 medications that are very, very effective in CPVT. So I'm working on it, Allison, to make sure that if somebody faints the way your daughter fainted, and we can talk about that a little bit, is what was your daughter's spell, that they got to get put on a treadmill.
Yeah.
It's so easy to do, and that's the part that's maddening. If it was a hard test and the system isn't set up to do it, you'd say, okay, maybe I'm asking too much out of the system. But it's such an easy test, and that's just what boggles the mind. So, Allison,
Yeah.
what say you as to what you have been doing, and now as part of your mission, you've gotten connected with us at SADS. What has SADS Foundation done for you? What are you trying to do for it as we sort of bring us towards a close?
Yeah. We so SADS was when I first was given the potential that Carly had CPVT, I started to Google it, and when you Google CPVT, your name and the SADS Foundation comes up. And so I started clicking my links and reading and looking at resources. And then when we had the confirmed diagnosis, then I went to the SADS Foundation to get her school care plan, and I took that to the school nurse, and of course they were petrified when they read it, and they immediately went and got all of the teachers CPR certified. They got AEDs, they did AED training, and they were, for a while they were, kind of had a relay system of keeping track of her on campus as she crossed campus back and forth between classes. And then again, as we transitioned to high school, in the first couple years after Carly's diagnosis, she was pulled from competitive dance and competitive soccer, and so she went through a lot of grief and coping issues, trying to deal with that and changing our lifestyle that was very heavily focused in outdoor activities and sports, and finding what is the new thing that brings us joy. And it took about 2 years for her to get through the anger and the sadness and the denial piece of it, and then to be ready to want to do something about it. And so I think just before she turned 16, she was like, let's do something. And so we started to look at volunteer opportunities through SADS. And so she was looking at ways to be like a social media advocate. And then we started to volunteer in our community. So her little brother is in Little League, and we're heavily involved with that. So we did a CPR and AED training. So we added an AED to our Little League, and we stop doing that. Sorry, we're shaking here. We added CPR training and then bystander CPR and an AED program to the Little League. So Carly helped to do the AED demonstrations and the bystander CPR training. And then we've done 2 health fairs since then, and we did a pub crawl in our area, in our neighborhood, and raised awareness for SADS. And we had part of what Carly's joy was that she found when she got pulled out of sports was she became interested in cooking. And so when she was old enough, she got a job at a local, like a local brew pub as a line cook. And so we got her restaurant involved as well. So we had about 60 participants that came through and did our pub crawl with us. We did a big social media push. We made t-shirts. The restaurants all advertised for it, and they all donated to help support the cause. So we got a great first event established and our footing down. But SADS was instrumental in helping me figure out how to create the event, giving me access to the logos and the tax ID numbers so that people could donate and, put that down as a write-off for their business.
Wow.
So it was really
incredible.
fantastic.
I
Yeah.
love hearing that. And thank you on behalf of the SADS Foundation and all the families, what you've chosen to do to advocate. I'm grateful for that. You two are both heroes or heroines. Carly, what's around the corner for you as Miss Senior on university campus visit? Where might you be a year from now? Are you going to reveal your shortlist to the world?
I'm hoping one of the San Diego schools.
And do you know you have
Hopefully UC San Diego.
and that's where you're at now, right?
Yes.
And you have a career interest already as a 17-year-old or not yet?
I do not. I am very indecisive.
That is
Not
A-okay.
quite sure yet.
Well, I'm grateful that we get to have this conversation. I'm very thankful that the 3 strikes in the name of the World Series did not mean you're out, that you're very much in the game of life, and you have the best years in front of you. And appreciate your mom so much, Allison. Just the picture of a mom who just will not accept status quo, and when it just doesn't gel with their gut instinct of this is not vasovagal. Yes, vasovagal is super common, but what my daughter's doing, this is not vasovagal, and not accepting the status quo for the answer and fighting and advocating until you found the answer. So I appreciate you. I appreciate your story. I think it resonates so well with all the families. I imagine for some of the families, as they think through their close calls, it does, like you said, it does that mental trauma, and there is trauma and then PTSD-like symptoms that some of our families endure. And so put a shout out for a good friend of mine, Dr. Sam Sears, just recorded a mental health webinar, and it will be released very soon for everybody. I'm going to get him on SADS Live one of these times to talk about resilience and things like that. The other thing coming up next Saturday, a week from tomorrow, if you're in Baltimore, we have the November 4 family conference in Baltimore, Maryland, and then I'll be seeing you a couple times in November for the next 2 SADS Live episodes. So just thankful for their story, and for all of you who chose to join us. When you get it, review it, forward it on. I don't know, it's on a lot of social media venues. Forward this so that we can increase awareness that if you are out there or you know somebody out there who's fainted suddenly without much forewarning during sport, during running, during play, during jumping, during climbing, during swimming, that's not vasovagal. That is not the normal faint. That is the warning faint. And that needs a call to action. And it needs more than just a resting 12-lead ECG and an echo or an ultrasound of the heart. If you faint suddenly during exercise, that must be followed by a treadmill stress test to make sure we look for and rule out this less common entity of our genetic heart diseases, much less common than long QT syndrome, the one called CPVT, for which we have just even now way too long of a delay in diagnosis. And as you saw in Carly's story, from first faint to correct diagnosis, over 3 years. We must do better than that. And together we will. So be well out there. Have a wonderful weekend and happy Halloween. If you go trick-or-treating in 4 days, be safe, live and thrive. Blessings to all of you. We'll see you next time.